as you know, the HERIZON-GEA-01 study was a phase 3 study, and this study enrolled the patients with centrally confirmed HER2 positive gastroesophageal adenocarcinoma, irrespective of PD-L1 status, and patients were randomized to either control arm with trastuzumab and chemotherapy and to experimental arms with Zanidatamab, the bispecific anti-HER2 monoclonal antibody plus chemotherapy, or again Zanidatamab chemotherapy and the PD-1 inhibitor Tislelizumab. We saw the data presented at ASCO GI 2026 and then at ASCO again in 2026, and this phase 3 study is a source of many data. So this presentation is basically focusing on response durability and post-progression outcomes, because you know that the study met its primary endpoint, dual primary endpoint of progression-free survival, with both experimental strategies, and also already showed an early separation in overall survival in the comparison between the triplet, Tislelizumab, Zanidatamab and chemotherapy versus trastuzumab and chemotherapy. So this was just the first interim analysis, and in this exploratory analysis we performed here at ESMO GI 2026, basically we focused on response durability. So this means that even if the overall response rate was similar, nearly identical in the two Zanidatamab containing arms, and very high across all treatment arms, including the control arm, there may be differences in the response quality, and this may explain the earlier and greater separation in overall survival seen with the triplet. So basically what we saw is that even though time to response and overall response rate was similar in the treatment arms, we saw that duration of response was quite different, and it increased from 8.3 months with trastuzumab chemotherapy to 14.3 months with Zanidatamab and chemotherapy to 20.7 months with the addition of Tislelizumab. And also regarding the depth of response, it was numerically highest with the triplet. So the major separation between the two Zanidatamab containing arms is clearly related to the duration of response, durability of response, which was maintained over time. Another important aspect is PFS2, and also PFS2 favored the triplet, both in the intention to treat population and among responders. And so in the intention to treat population, median progression-free survival 2 was 26.6 months in the triplet with Zanidatamab and Tislelizumab, and 20.6 months with the chemotherapy and Zanidatamab, and only 16.1 months in trastuzumab and chemotherapy control arm. So this is basically showing us that not just RECIST response is important, but also the quality of response, and this is going to condition the subsequent course of the disease. And these results in terms of progression-free survival too were seen despite the fact that a lower proportion of patients in the triplet with Tislelizumab and Zanidatamab received subsequent anti-cancer therapies. So this is the first interim analysis of the study. We will see in the future, in future meetings, the second interim analysis, and we know very well that in HER2 positive disease the curves are going to keep separating, and we will see probably more impressive results with the follow-up accumulating over time.